course has been really good. I'm very much a beginner at this, although I've been restoring implants for over 10 years, but obviously never surgically placed. So this course has been really, really informative. It really has been from a GP's perspective, which is what I really like. So they've been very good about covering things that I would be having questions about in my own office. Lots of hands-on, personal time with the instructors to ask questions. Lots of real good information. I think it's really important. Sometimes you will go to CE classes where there is, just a large number of attendees, but not too many instructors. So it's hard to have one-on-one time. The intimacy of this group is really, really a plus. From what I understand, they do that on purpose because they really want to be able to give each GP that personal attention, to ask questions, to interact, to be able to show you things. It's nice when you see a presentation on a board, but it's also nice when the instructor can talk to you right next to you. And that's what this has been. I really, really recommend that. Very easygoing. They weren't trying to talk over our heads. They were, like I said, talking to us very much from a general practitioner standpoint. It was really friendly, very nice, but very savvy, very knowledgeable. So yeah, it was well-rounded. To be honest, since I just placed my very first implant just a little bit ago, I was really surprised at how smooth that went. For some reason I had a lot of trepidation about the process, and they've emphasized to us to obviously be looking for very straightforward cases, and so that's what I had this morning on my first implant placement. But it was really, really nice being able to have them there in the room, step by step with me, but yet I was the one doing the treatment. That was really, really cool. It was a lot easier than I thought, and of course still case selection always so important, as a beginner. But I'm really motivated to be moving forward and start doing these on my own. Well, like with any procedure, you don't want to get in over your head. You need to know your limitations, and you need to be smart about that. But assuming that you have a straightforward case as a beginner, to have confidence in your abilities and your skill level, and it's all about the patient's well-being. That's what's the most important thing. And if you have confidence in any procedure, you're going to project that to the patient. Your patients want you to be confident in what you're doing to them. And so I feel like this course has helped to give me that confidence. Starting out surgically, I've been confident restoring for a long time, but surgically, of course, this is my first step, and I'm going to walk away with it from it with a lot of confidence.